Yeah, there are so many good questions coming in about the vaccine right now. We are answering all of those with Cone Health's Director of Pharmacy and Oncology, Dr. Harvin. First off, a lot of people are saying this week some of the hospitals around the state required their staff to get vaccinated. We saw protests of medical professionals saying they weren't going to get vaccinated. If it's so safe, why are some of these medical professionals saying no thanks?
Yeah, it's a great question, and that's difficult. I think for those we would have to ask them directly. I will say that I entered into a number of conversations today. So Cone Health was also one of those facilities in North Carolina. The North Carolina Healthcare Administration came together and made these recommendations. So again, you'll see pretty much every health system in North Carolina went forward with that recommendation. And part of that was we knew that there were going to be some that pushed back against it. Unfortunately, vaccinations have gone outside of the conversation just around the data and science. It's become very politicized. There are certain aspects in there, and I'll say that misinformation can take root even with those that are gifted in certain aspects and have had a lot of training. And so when we really look at it, it's a very small number of our staff members that have voiced serious concerns. A lot of times when we talk through it of what those concerns are around the vaccine, it's evident that there are still some gaps in fully educating all of the research and the data that has gone into bringing these vaccinations to the market. But I want to contrast that with the fact that we already require vaccinations for our staff members at pretty much most hospitals across the nation in the right of influenza. That's an annual vaccine that pretty much everyone working in the hospital system is required to get, especially here in North Carolina. And so that requirement for members to get the COVID-19 vaccine is in that same vein. We are here to protect our patients. We are here to protect our teammates and protect our community. And the best way we can do that is with this vaccination.
Speaking of misinformation, someone just said, is it true that the life expectancy after being vaccinated is only 3 years and everyone's going to die?
I'll be honest, that's the first time I have heard that. And so I can pretty confidently say that is not accurate. And again, this brings up a great fact that unfortunately there's a lot of malintent out there on the internet and certain social media aspects where they are really just feasting on this ability to promote misinformation and vaccine hesitancy. I wish I could tell you the why behind it, why they have decided this is something that they want to speak out against and prevent us from getting our lives back to normal and just accepting the vaccine. But I think we can all equivocally say that there is no data out there that suggests that your life expectancy drops down to 3 years after getting the vaccine.
So a lot of people online who are spreading some of this misinformation really play up the fact that it doesn't have full FDA approval yet. It's just the emergency use authorization. Does that mean it is less safe?
Absolutely not. And so this is something we hear time and time again. And so it's something that we have to continue reiterating. Emergency use authorization is a tool specifically for something like this, an almost unprecedented event that has direct public health issues associated with it. And so that is what this was designed to do, is to be able to bring something available to the public very quickly. It still goes through clinical trials. It still has to have its safety and data efficacy. What we don't have is the timeline. The timeline is what separates the emergency use authorization from full FDA approval. Now, going forward, the current administration said that they expect these vaccines to have full FDA approval by the end of August. And that's just the timeline that's involved there. When you have full FDA approval, it just means that they have a certain number of months post a trial in terms of follow-up aspects that are required to get that full approval. So we all 100% expect these vaccines to get on full FDA approval. It'll just be within this, like I said, next month, probably by the end of next month, we will have it.
We're back with more of your questions right after this, including on timelines when children 12 under might be able to get the shot.